odd thing to do, to put GPs in A&E departments. There's something slightly weird about that, isn't there? We'll come to your calls in a few minutes' time, but first, Stephen Dorrell joins us, former Health Secretary and former Chair of the Health Select Committee. He now chairs the NHS Confederation. Stephen, thank you very much indeed for coming on. Were you expecting anything different from these figures today?
I think the honest truthful answer to that is that I wasn't, no. I think that it's been known for some time that the health service is under huge and growing pressure, and I think it's been fairly well trailed ahead of yesterday's budget. The government wasn't going to provide additional resource any significant additional resource for the NHS, although the additional support for social care is very welcome, and I think we do have to get used to the idea that the NHS and social care are one system. So it isn't actually true to say there's nothing additional for health and social care. There is an important additional resource in the short term for social care, but there's also a recognition from the government, and I welcome this, that we need to think more seriously about how we fund at least the social care element of this going forward. I think that actually we need to think more seriously across the whole of health and social care, not just social care on its own.
So if there isn't any more money in the short term for the NHS, what choices does the Health Secretary have to make sure that this winter isn't repeated next winter?
Well, when you think about the healthcare system, it's like any other part of what we do as a society. You can either do things more efficiently, or you have to pay more if you want more of it. Now, the truth is that demand for health and care services, seeing the two together, is on a growing trend all over the world. There's nothing unique to Britain about that. It's on a growing trend. And if we want to meet that demand as a society, and I've never heard anybody say we shouldn't, if we're going to meet that demand, we either have to improve the efficiency of our health and care system, or we have to give it more money, or in the real world, we probably have to do both.
A lot of people within the NHS say, well, we are working at full capacity, that there is no way that we can make ourselves more efficient. I'm always sceptical of that argument, because I think there are always ways that, even if you have a sort of 1% approval rate, I mean, there are always ways to be more efficient, aren't there?
Yeah, I agree with that. I don't actually think there's anybody, or there'll be very few people working in the health and care system who would say there is nothing we could do to make it more efficient. I think there are sometimes arguments against specific proposals to make it more efficient, but I don't think anybody seriously thinks that you can never improve its efficiency. The question is whether we can improve the efficiency of the system as a whole quickly enough to allow it to meet demand within the budget that's been made available by the government. And I think that's the hard edge, and that's why I suspect Jeremy Hunt was sounding a bit uncertain today, because he said that he anticipated performance against this single target of A&E waiting times to improve during this year. Well, the truth is you probably could do that, but only by focusing on it to the exclusion of other measures of important measures of quality and activity. And the truth is that we need to ensure that there's urgent and emergency care is available, but the health and care system needs to deliver balanced services to a whole range of people, not just to the people who turn up at A&E departments.
I mean, I can just think of one very small way that they could actually save a bit of money. Every 6 months I get a letter from the NHS saying I've got a new eye appointment because I have diabetes. Now, why couldn't that letter be emailed instead of posted? That's 60 pence a time that they post it. I don't know how many people who have diabetes have these appointments, but I see no reason that they have to send letters to do that.
Well, I think that's a good example. I think there are, as I said, I think there are very few people in this country who think that this particular that health and care services couldn't be delivered more efficiently. I'm sure we've all got examples of how that's possible. I actually think that there are some big efficiencies we could deliver if we looked more imaginatively at the difference between the totally artificial distinctions, for example, between social care and community health services, primary health services, and instead of running them as separate silos, actually joined them up so that they delivered a service that was focused on the needs of individuals rather than reflecting traditional institutions. It's the same thought process as your point about a letter rather than a text or an email, but it's carried to the next level. We ought to be rethinking how we deliver the full range of public services, actually. We should remember that it isn't just the NHS or health and social care. If we don't deliver proper support to the community through housing services, through people who have need for adaptations in their houses, then they fall over, or the housing is inadequate for their needs, and they end up in A&E departments or in hospital, or that we can't discharge them from hospital. These things are joined up, and the problem, or the need is joined up around the needs of an individual citizen. Too often the services themselves are not joined up in order to deliver what's required efficiently.
Stephen, thank you very much indeed for that. I think that this point about there must be efficiencies that could be made, I've already given one idea. I wonder whether somebody ought to start a sort of crowdsourcing effort. Maybe it could be Stephen's organisation, the Confederation, NHS Confederation. Do a crowdsourcing for ideas as to what savings could be made. I mean, if it came up with £250 million worth of savings, now you might think, well, that's a bit of a drop in the ocean compared to the budget of the NHS, which I think is £115 billion at the moment. But £250 million